In the heart of Washington, a massive new bill is causing ripples and making waves. Its potential impact felt across the nation. The bill promises significant changes to the way the government operates and how it affects the lives of everyday Americans. It's called the One Big Beautiful Bill Act, a name that reflects the ambition and scope of the legislation, championed by former President Donald Trump. This bill represents a bold vision for the future of the country, aiming to reshape key aspects of American society. This sweeping legislation bundles together a series of significant policy changes. It's a comprehensive package that touches on various aspects of American life, from the economy to social welfare. At its core, the bill proposes substantial tax cuts, aiming to stimulate economic growth and provide relief to taxpayers. These cuts could affect individuals, families, and businesses alike. It also includes dedicated border wall funding, continuing a key policy initiative from the previous administration focused on border security and immigration control. Perhaps most controversially, the bill proposes a major overhaul of the social safety net, potentially altering the way government assistance programs are structured and delivered. This aspect of the bill has sparked intense debate and concern among various groups. All of these elements are combined into one ambitious package, making it a complex and far-reaching piece of legislation. The sheer size and scope of the bill mean that its potential consequences are significant and wide-ranging. Its reach is personal. It's not just about abstract policy, it's about how these changes will affect real people and their families. The bill has implications for healthcare, potentially impacting access to medical services and the cost of insurance. It will also affect family finances, influencing how much money families have available for their needs and priorities. And it could reshape opportunities for millions, influencing job availability, education, and economic mobility. Supporters tout fiscal discipline and personal responsibility, arguing that the bill will promote economic growth and empower individuals to make their own choices. They believe it will lead to a more prosperous and self-reliant society, while critics warn it shifts the burden onto the most vulnerable, raising concerns about the potential impact on low-income families, the elderly, and individuals with disabilities. They argue that it could exacerbate inequality and undermine essential social safety nets. The bill arrives at a politically charged moment, further intensifying the debate and highlighting the deep divisions within the country. It's forcing a national debate about the fundamental role of government in society, prompting Americans to consider what they expect from their government and how resources should be allocated. And it's raising crucial questions about the future of the American social contract, challenging long-held assumptions about the relationship between citizens and their government. It aims to roll back decades of social policy, potentially reversing many of the programs and initiatives that have been put in place to support vulnerable populations, prioritizing lower taxes and reduced government spending, reflecting a belief in limited government and individual responsibility. Our goal: to provide you with a clear and unbiased analysis of this complex piece of legislation, to break down what's really in this bill, examining its key provisions and potential consequences, and how it could impact you and your community, providing you with the information you need to understand the potential effects on your daily life. This isn't just another political story, it's a story that will shape the future of our nation. It's about the future we'll all share, and it's crucial that we understand the choices that lie ahead. The One Big Beautiful Bill Act will touch Americans in very different ways. High-income earners benefit from extended tax cuts, keeping more of their income and investments. Seniors face anxiety as Medicaid funding is cut, threatening long-term care for millions who rely on it. Low-income families could see reductions in SNAP and housing assistance, forcing tough choices between food and rent. Students may gain new vocational opportunities, but cuts to aid and family support could make education harder to access. Proponents say these changes encourage self-sufficiency, but for many, they mean losing a vital safety net. The bill's vision of independence clashes with the reality that many need support to succeed. At the heart of the bill lies a dramatic and potentially transformative Medicaid overhaul. This represents a fundamental shift in how the program operates and who it serves. A key component of this overhaul is the introduction of nationwide work requirements for Medicaid recipients. This marks a significant departure from the program's traditional focus on income eligibility. Under these new rules, most able-bodied adults will be required to prove they are actively working a certain number of hours per week to maintain their Medicaid coverage. This provision aims to incentivize employment and reduce reliance on government assistance. Alternatively, individuals can meet the work requirements by volunteering in their communities. This provides an avenue for those who may face barriers to traditional employment to still maintain their healthcare coverage. Enrolling in job training programs or vocational schools also counts towards fulfilling the work requirements, offering individuals the opportunity to gain new skills and improve their employment prospects while keeping their coverage. But these new requirements come with a significant administrative burden, adding layers of paperwork and bureaucracy for both Medicaid recipients and state agencies. If you miss a deadline for submitting paperwork or make even a small mistake on your application, then you could face the consequence of losing your health insurance coverage, potentially leaving you without access to vital medical care. Furthermore, states are now granted the authority to charge premiums for Medicaid coverage and implement copays for doctor's visits and prescription medications. While these costs may seem small in theory, they can represent a significant financial burden for low-income families who are already operating on extremely tight budgets. Healthcare advocates and critics of the bill warn that these added costs will likely discourage many people from seeking necessary medical care, especially preventative services. This delay in seeking treatment could ultimately lead to more serious and costly health crises down the line, as minor conditions go untreated and escalate into emergencies. So, what is the potential result of these changes? Experts predict that millions of Americans could lose their Medicaid coverage, and this isn't necessarily because they are refusing to work or contribute to their communities, but rather because they are unable to successfully navigate the increasingly complex and burdensome red tape associated with maintaining their benefits. Hospitals, particularly those located in rural and underserved areas, could face significant financial strain and potential closures as a growing number of patients become uninsured and unable to pay for the care they receive. The potential ripple effects of these changes threaten not only the health and well-being of individual patients, but also the overall stability and accessibility of the entire healthcare system, potentially jeopardizing the health of communities across the nation. The bill's philosophy is clear. It represents a significant shift in how government aid is perceived and distributed. It's a move towards a system that emphasizes personal responsibility and active participation. Government aid should be temporary, a bridge to self-sufficiency rather than a permanent crutch. The underlying belief is that individuals are more likely to thrive when they are actively engaged in bettering their own circumstances, and recipients must participate in work or community activities, contributing to society while gaining valuable skills and experience. This participation is seen as a crucial component of breaking the cycle of dependency. Able-bodied adults ages 19 to 64, the demographic considered most capable of contributing to the workforce, must log at least 80 hours a month, a substantial commitment designed to ensure active engagement. This requirement is central to the bill's aim of promoting self-reliance in work, training, or volunteering, offering a range of options to accommodate different skills and circumstances. The bill recognizes that not everyone can immediately find employment, so it provides alternative pathways to fulfill the participation requirement. To keep Medicaid, the government-funded healthcare program for low-income individuals and families. This linkage of Medicaid benefits to work requirements is a key aspect of the new legislation. While the bill allows for flexibility, recognizing the diverse needs and challenges faced by individuals seeking assistance, jobs, school, or volunteering, providing multiple avenues for meeting the required hours, practical barriers loom large, potentially undermining the bill's intended outcomes. These obstacles could prevent many from successfully meeting the new requirements. Lack of transportation, a common challenge for low-income individuals, or childcare, a significant expense that can be a major impediment to employment, can make meeting these requirements nearly impossible for many, particularly single parents and those living in rural areas with limited access to services. The bill doesn't provide new funding for support services, which are essential for helping people overcome these barriers, leaving states to fill the gaps, potentially exacerbating existing inequalities and straining already limited resources. Exemptions exist for disabilities and caregiving, acknowledging the unique challenges faced by these populations, but the process is complex and paperwork-heavy, potentially deterring eligible individuals from applying and receiving the exemptions they deserve. For those with chronic illnesses or unstable situations, such as homelessness or domestic violence, maintaining coverage could become a bureaucratic nightmare, adding further stress and instability to their lives. the administrative burden could outweigh the benefits for these vulnerable individuals. The intent is self-sufficiency, a laudable goal that aims to empower individuals and reduce reliance on government assistance, but the reality may be more red tape and lost coverage, particularly for those who are already struggling to navigate complex systems and overcome significant obstacles. The long-term consequences of these changes remain to be seen. The bill shifts Medicaid funding from an open-ended federal match to capped block grants or per capita caps. States get more control over eligibility and benefits, but with less federal money that grows slower than healthcare costs. This flexibility comes with tough choices: raise state taxes, cut other services, or reduce Medicaid coverage. States may drop optional benefits, tighten eligibility, or lower payments to doctors and hospitals. Fewer providers may accept Medicaid, creating coverage deserts even for those still enrolled. Cuts to mental health or addiction services could devastate communities already in crisis. The federal government hands states both the power and the burden of deciding who gets care and who doesn't. The stakes for state lawmakers and vulnerable populations have never been higher. Beyond the politics, the bill's impact is measured in lives. Nonpartisan estimates suggest millions could lose Medicaid coverage due to work requirements and funding caps. Most at-risk low-income working adults in unstable jobs who fall between Medicaid and private insurance. The bill could reverse gains made under the Affordable Care Act, especially for those on the economic margins. Hospitals may face a surge in uninsured patients, leading to service cuts or closures, hurting entire communities. The human cost extends far beyond statistics, threatening the health and stability of the nation's most vulnerable. The bill isn't just about Medicaid. It permanently extends tax cuts for individuals and corporations. Supporters say this will boost the economy, but the price is deep cuts to SNAP, housing aid, and other safety net programs. Billions are allocated for the border wall and increased border security, a signature Trump priority. The trade-off: lower taxes and more security spending, but less support for those in need. Critics argue this approach benefits the wealthy and corporations while increasing poverty and hardship for many. The bill's priorities are clear: tax relief and border security over social support. The debate is about what kind of country America wants to be. Introducing the bill is just the beginning. It faces a tough road in Congress. The House and Senate versions differ. House favors stricter cuts and block grants. Senate offers more exemptions and per capita caps. Both chambers must reconcile their differences in a high-stakes negotiation. Every detail, from work requirements to funding formulas, will be fiercely debated. The final bill could look very different from either original version. The outcome will shape the nation's social contract for years to come. The legislative battle ahead will test the resolve and values of lawmakers on both sides. As the bill moves through Congress, America faces a defining moment. The choices made now will shape healthcare, economic opportunity, and the social safety net for a generation. Will we prioritize individual responsibility and lower taxes, or collective support and security for the vulnerable? The stories of real people, seniors, parents, workers, must not be lost in the debate. Engage, speak out, and pay attention. This is not a spectator moment. The bill forces us to confront our values and decide what kind of nation we want to be. The effects will be profound and lasting, touching every American life. The journey ahead is uncertain, but it's one we all share.